It is a welcome return to the salon for hairdresser Brenda Chiaro. After more than 3 months of mandatory quarantine, she is back in business with cuts, highlights, and blowouts, but with restrictions.
It hit us hard. We went along with the quarantine starting with the first stage and we waited patiently, but that's affected our incomes.
Venezuela is reopening under what's being called the 7-for-7 system. Brick and mortar stores are allowed to open for 7 days. Following that, they are closed for 7 days. In addition to the 1 week on, 1 week off rule, they must follow strict sanitary measures, including taking visitors' temperatures and requiring people to wear masks.
It was bad to be at home. We couldn't keep the store closed forever.
Initially, just a few types of businesses were included in the reopening, with staggered hours of operation to keep the number of people on public transportation to a minimum.
Officials say the new working rules are meant to help the economy to reopen, but at the same time to cut the routes of transmission for COVID-19. Health authorities check the numbers of COVID-19 cases reported every week, and if an outbreak is detected in a particular part of the country, lockdown orders will be extended there.
Pharmacies and food markets are exempt from the 7-for-7 plan. They are the only businesses allowed to remain open continuously. Even banks are only open every other week. Economist Leonardo Vera says the quarantine has taken a heavy toll on Venezuela's already failing economy.
Unfortunately, the outlook for Venezuela is very bleak. Venezuela has the worst drop in gross domestic product in the region, and on top of that, it doesn't have enough resources, economic aid, or international financial assistance.
These scenes are from an off week, with shops across the country closed. So people across Venezuela are making plans for the next week, when the 7-for-7 system will allow certain shops to open and people to get a taste of the life they knew before the pandemic. Maritrini Mena, CGTN, Caracas.